All right, welcome back to Pharmacist on Call, your 1 hour forum. Your doctors are busy, your pharmacists are busy, they don't have time. For this hour, I do. So call in with those questions and those comments. We're going to get right back into your calls. We've got Marilyn on line 1. Marilyn, welcome to Pharmacist on Call. How may we help you?
Hi there. I have a question. I would have itching in my right ear.
Yes, ma'am.
And also with the itching, I would get a little hum, and I've lost some hearing in that right ear. I'm 59.
Yes, ma'am.
I've never had problems with my ears before, but I'm not sure what to do about it.
Okay, so you say, so the ear is itching, and what was the second piece you said?
I get this little buzzing, like or a hum.
Okay, now, is that coming, are you sticking something in your ear trying to relieve the itching?
Well, I used to, what do you call it, scratch or use the outside of the ear and use the tip of my finger or the bottom of my finger and just rub the outside
Yes, ma'am.
of the ear to try and relieve that itch.
Yes, ma'am. Okay, but not where you stuck an actual object inside the ear and hit anything?
No.
Okay, because then I would think maybe, you have some eardrum damage. It may be worth a visit to look for an ENT. Sometimes if there's chronic itching, you may either have a wax buildup, so you could get something like a Debrox, a solution that you can pour in the ear, and it will crust up that wax and make it easy for you to remove.
I've tried that as well,
okay.
and I've also seen an ENT doctor. He said I had compacted wax, and what he did was suction out the wax.
Okay.
And then after a few months after that, I went back and saw another doctor, and like 4 months later, and my ear was compacted again, and she flushed it out, and it was okay after that, but then maybe a month later, I started having the same problem.
Okay, yeah, and then some people are just going to produce an enormous amount of earwax, and I can remember one of my patients, she's actually a viewer, she uses a certain type of candle to deal with that earwax, and I think she said it takes 2 people to do this. So you may want to look up what those candles are for earwax, and she said they're very effective in relieving that. So I would probably go that route since they're having to do it so often.
I wouldn't have anyone to help me.
Okay.
By myself.
But it may be something that you could probably do yourself. But I would investigate that, especially since you're telling me you're hyperproducing, and this is the same situation that my patient is in. And it's been very beneficial to her.
So it's a candle?
Yes, ma'am. Yeah, a candle. Yeah, I was looking at her like, this. I couldn't believe what she was telling me. So yeah, it's a candle.
A lit candle, or?
Yeah, a lit candle. I guess you sit by the ear.
Oh my. Okay.
Yeah, so if you call the store when she comes in again, I'll get the exact name, or I tell you what, we'll just put that on the show, on the menu for the show next week.
Oh,
so, because I'm sure you're not the only person that's being bothered by this. So.
No, I'm not. Well, thank you so much.
Yes, ma'am. All right, thank you.
Bye-bye.
All righty, bye-bye. All right, everyone, great questions. I did want to say a couple of things. I forgot a birthday. Elizabeth Fritz, who has a birthday coming up this month as well. And then secondly, I wanted to let all of you know that next Wednesday, we will be doing, this Wednesday coming up, we will be doing our Customer Appreciation Day at the pharmacy. So we'll have some food, we'll have some games, and I guess a whole bunch of other stuff. Probably a big Pruitt's Discount Pharmacy cake as well. So you all come. The event will be Wednesday. That will be from 10 a.m. to 1 p.m. Also, as part of that, for those of you who have Medicare Part D or open enrollment, we're on the cusp of open enrollment. If you want to kind of evaluate which insurance plan is going to be better for you based on your copays, which ones will pay for your medicine, which ones will be the least amount of premium out of your pocket, which one you will go into the donut hole, in a longer period of time. all of those things. We will have some insurance specialists out there to go over this with you as part of as part of the service for our Customer Appreciation Day. So make sure those of you, customer meaning you who view the show as well, come in. So that'll be Wednesday, 10 a.m. to 1 p.m. I also wanted to mention a couple of things. A number of times during the show, I mentioned how medication is going to be different for everyone. So a new service that we're offering is one, blood type testing, because depending on your blood type, you're going to have an outcome with different foods, different supplements, different beverages. And so it is important to know your blood type because, hey, it affects everything. It also determines which diseases you're going to be at risk for. So we do blood type testing now in the wellness clinic inside of the pharmacy. Another piece that we do is pharmacogenomic testing. And so what pharmacogenomic testing is, it is a DNA swab of the mouth. We'll put it on a panel, and what it will tell us is whether you process drugs, or which drugs you process quickly, which drugs you process slowly, and which you just kind of process at a normal rate. So for instance, I get a mouth swab and I'm a pain management patient. It will give me the information I need to take to my doctor to let him know, hey, don't put me on hydrocodone because I rapidly metabolize this drug. I need to be on oxycodone because I metabolize this drug a little bit slower. But we got another call, so we're gonna get right back into that in a minute here. We've got Carolyn on line one. Welcome to Pharmacist-on-Call. How may we help you?
I'm a diabetic, and I was wondering, metformin 500 milligrams, would it cause hair loss?
Metformin cause alopecia?
What, hon?
I don't think that is one of the side effects. Is that, are you on hydrochlorothiazide as well?
No, metformin. I'm on
That's the only
it,
thing?
500 milligrams.
I don't think that's one of metformin's side effects. Usually the upset stomach, the metallic taste in the mouth, the GI disturbance, going to the bathroom a lot, but I don't think, if it is a very small percentage of people.
Okay.
But I would also caution you to take a look at maybe your thyroid function and have your doctor run a thyroid panel because that can affect hair loss as well.
Okay. Thank you. I really enjoy your show.
Well, thank you, ma'am.
Bye-bye.
All righty, bye-bye. So as I was saying, getting back into the pharmacogenomic testing, what this does is it basically personalizes medication for you. So you go in armed knowing what medications are going to be good for you and which ones are not going to work for you. So what does this do? It decreases medical waste because now you're not on a medication that's not going to, waste your time and not be good for you. Now you're going to be put on a medication that you process appropriately, that your body is going to respond to. So look for me to, in the coming shows, to get a little bit more in depth in that. And hey, we may even have a commercial explaining a little bit more. So that's pharmacogenomic testing along with blood type testing. So we'll talk about blood types for a second here. So there are 4 basic blood types. You have your A, your B, your O, and your AB. And then they're further subdivided into positive and negative rhesus factors. So your A's, the type of diet that you should have if you're a type A, should be vegetarian. So these are the people going to be your leafy vegetables. You're going to need to avoid meats, things of that nature. Your B's, you're going to be kind of like an omnivore. You can eat meat, or you could be kind of like a vegetarian diet, but for some reason B blood types need to avoid chicken. I believe it causes some sort of agglutination in the blood or clumping of the blood. So avoid chicken for all you B types out there. And then there are the O blood types, which is what I am. So these are the carnivores, the meat eaters. It's the most common blood type. Actually, I believe it was the first blood type. So these are the cavemen, all the people that ate, there was nothing here but dinosaurs, I guess. So yes, everybody would have been type O's. And then of course AB, which is going to be a mix of all the other blood types there. But we will be discussing that in the coming shows and give you more of an in-depth breakdown of what the different blood types are and how they affect your dietary choices and which diseases they put you at risk for. But stay right there. We'll be right back.